Okay, that's better. Where were we? Today we're going to talk about a very important topic and how our patients' lives are at stake because we're going to talk about alarm fatigue and patient safety.
In the heart of our healthcare system, where every second counts, the symphony of alarms plays a critical role. But when these alarms become a nuisance, it's time to address alarm safety in our hospital.
Alarm safety is paramount in our hospital. It's not just about the noise, it's about ensuring that each alarm is recognized, responded to, and resolved with the urgency and attention it deserves. PVHC has implemented a no-pass zone policy, which means that any employee, regardless of certification or patient knowledge, are to respond to a patient's call light or alarm without passing the patient's room. The goal of a no-pass zone is to improve patient experience by ensuring that patients' needs are addressed quickly and effectively.
We took time to sit down with Stephen Gard, who is an emergency room provider, to get his thoughts about alarm fatigue and how it affects patient safety.
Hello, my name is Stephen Gard, and I'm a physician assistant that works in the emergency room at Three Rivers Hospital. As an experienced provider working with nurses and dealing with what is called nursing fatigue of alarms and different, how we would say, triggers that nurses go through, I've definitely noticed throughout my career that it has been very difficult that alarm fatigue becomes an issue as the same patient pushes the same button 15 times to maybe just have her come and correct the remote or move different things. So to be able to adjust this and understand kind of the provider fatigue, to be able to rotate different people to go see the patient, to be able to have the experience of an experienced nurse to be able to maybe question and ask a provider to go check on the patient is, in my experience, been very handy and helpful. As we're able to go and address some of the needs and concerns of the patient, the call light and the pushing the button goes away. If it's for pain, sometimes the nurse doesn't have any other way to correct the pain, and we're able to, as providers, to go in there and discuss the patient's pain or maybe positioning or other things that can actually help the patient long term, and that reduces the call lights for our nurses. Some of the other things that are helpful is as we have a no pass policy at the hospital. So if we see a call light, we need to address a call light. And so even as a provider, when we're walking by and we see a call light on, it's important that we can stop in and help. At different times I've seen patients needing assistance or nurses who are helping with the patient who have pushed the call light because their hands are full. One experience I had where I was actually answering a call light where I had an intoxicated patient that was urinating everywhere, and I got a urinal and he filled the urinal completely full while I was holding the urinal, and needed to push the call light in order to have a nurse come by and help me. As the lights go off, she didn't respond for quite some time, and I was sitting there holding this gentleman while he was intoxicated and passed out, but holding the urinal that had filled an entire liter and waiting for another urinal to fill. We ended up filling 2.5 urinals for that human, which was a lot. But being there to make sure that we can reduce that fatigue so that when the call light goes off, that the nurse responds in a timely manner is very important. And as a provider, I feel that this is something that can actually improve the overall quality of care for our patients and safety for our patients, as well as burnout and fatigue for our nurses to reduce it. So thank you for letting me share my little bit.
Let's not get up out of bed. Remember, this is for your safety. What do you need to get up for?
I'm tired.
I get that. Let's get some vitals on you real quick, and we'll get you moved up in bed, okay?
Sure, I guess.
It starts with distinguishing between false alarms and those signaling real emergencies.
Reducing false alarms means healthcare professionals can focus on genuine alerts, enhancing patient care and safety.
Effective alarm management involves every one of us, from setting thresholds appropriately to understanding the protocols for responding to different alarms. Our training ensures we're all prepared.
The goal for a medical alarm is to give the healthcare professional ample time to act to prevent an adverse outcome.
So in the nursing setting, we provide chair alarms when residents are in a sitting position in their rooms. If they try to stand up, an alarm will go off and notify us that the resident is no longer safe.
How you doing?
I need help! Help me get up!
All right, let's get you up. So another type of alarm you'll see is the monitors. They vary. However, this one in particular right now is saying that the O2 sensor is off. That will alert you that your sensor is off. It'll alert for low O2. It'll also alert if your blood pressure is too low or too high, which is another alarm that we have in the hospital that is easy to get alarm fatigue about.
Here are some suggestions on how to promote alarm safety. First and foremost, we should educate staff and provide alarm management and protocols for alarm managing systems. Next, we should optimize schedules to ensure that alerts are not all assigned to one person. Maintain equipment, which includes regularly cleaning, inspecting, and replacing the equipment to reduce technical malfunctions. And lastly, establish a culture of safety, keeping in mind that the patient's safety is the top priority.
Patients need a restful environment to heal. By managing our alarms effectively, we not only improve our safety, but also create a more peaceful atmosphere conducive to healing.
With all that talk about different alarms and opportunities for false alarms, it is no wonder that alarm fatigue may occur. Remember, alarm fatigue occurs when there is a failure to respond to an alarm, and this may lead to patient harm, and it has led to patient harm. The US FDA reported more than 500 alarm-related patient event deaths over a 5-year time period. This is an important area for improved patient safety, and research has shown that improved alarm and alert design can lead to improved patient safety. It is a complicated area since we need alarms that are attention-grabbing to alert the provider that an abnormal event has occurred, but sometimes there are too many non-actionable attention-grabbing alarms.
In our commitment to patient care, alarm safety is a priority. By addressing alarm fatigue and properly ensuring all staff knows what the sounds of certain alarms mean, we ensure that every alert supports our mission to save lives and promote healing.